first we can now take a look at some of the graphics that we have that would indicate the situation of COVID-19 in the country that we would want to look at the numbers that so far we have. And you're talking about the total infections being 34,201. And out of this, the total test, like I said, 454,000. Recoveries, 58%, which is 19,893. The fatality rate at 1.7%, meaning the active cases are just 40%, which is 13,731. Let's take a look at something else. And this is the monthly tracking. And now the month of August is over. We are starting a new month today. So you'll see that the number of infections have declined. Actually, that bar graph is not indicative of the real situation, because you see that July had 14,270 and August has declined to 13,565, and the daily average declining from 460 in July to 438 in August. But also it is important to note that August had some of the highest number of infections reported on a single day, and currently we stand at 34,201. Let's take a look at something else that will show you where we are as a country. We're talking about the positivity ratio and how it has been changing over the past 1 week. So I want to begin with the 25th, when we reported 246 new infections. That was a positivity rate of 5.9%. Then we reported 213 new infections. That was 5.3% positivity ratio. Then we went up to 373 new infections. That was a positivity ratio of 7.9. Then that declined to 241 the following day, which is 5.3%. Then almost plateaued at 5.4%. Then went up a little bit to 5.9%. And now yesterday declined to 3.4%. So you can see that it's been moving up and down. We'll be putting questions to Dr. Andrew Were, who will be speaking to us shortly. So the conversation has been that if we were to flatten the curve, then that positivity ratio needs to decline to 5% and below. And of course, you see that curve, or is it a bar graph of how the weekly tracking has been? The numbers been changing from week 19 to now currently having declined to 1,693 in a week. And Dr. Were now joins us. Dr. Were, good morning, and it's good to hear and see you, hear from you and see you. Right, so let's begin with what we are seeing, the numbers that we are seeing. I was just showing the viewer a curve that we put up there of the positivity ratio and how it's been changing. As of yesterday, the positivity rate was at 3.8% or so. Is this indicative of the real situation, or is it limited to the amount of testing that we're doing?
I think generally we have been seeing a decreased number of patients coming to our institutions, to our health institutions to seek care. This means two things. One, either we're having an increased number of asymptomatic patients who are stable and are not able to, they're staying at home, using the home-based care. And also two, our number of testing. I don't think we have actually met the WHO standards or international standards of testing in terms of testing the whole population. So it might be indicative of the low testing that you are doing, which might give us a false sense of hope that actually infections are decreasing.
Right, and of course, I wanted to show you that that curve that gives us the positivity ratio. I don't know if they're able to do that, but as we do that, so now the Minister of Health has told us that the positivity rate needs to be 5% and below for us to say that we're flattening. If you look at that curve, it's been moving up and down over the past 1 week, because on Tuesday last week it was at 5.9%, then 5.3%, 7.9%, 5.3%, then 5.4%, up to 5.9%, and now 3.4%. Is it normal to see it flip-flopping, or is there anything that we are not doing to ensure that there's consistency in the numbers that we report on the positivity rate?
The information that we're not getting is this: if you are testing a particular, let's say, number of people consistently, and then use it as a guide of the decrease in positivity, then we'll have a more accurate figure. But if you look at these are numbers of people who have been tested. It's just a very small fraction, and actually these are the mostly the symptomatic patients who are seeking care in our facility. So, but I agree that we need to be at 5% for a considerable number of time to say that the curve has flattened. But the numbers might not be as accurate because of our testing capabilities. I don't still believe that we have really hooked up the testing for it to give us an accurate reflection of actually the positivity in the community. And actually, last week you saw there's where there was information that more than 3 million Kenyans might have been affected with this infection. If we go and actually test a considerable part of the population, then we'll have a more accurate. But from just the information we're getting from the facilities, actually, it's either people have become complacent or we are getting more asymptomatic patients within the population, and hence the number in terms of positivity that we're seeing.
Dr. Were, I want to take you through what the WHO is saying about the situation in Kenya, and this from a quote that came from that organization. If you can put it on there so that we see what they are saying. And the statement reads that we caution against a too rapid interpretation that this decline in reported numbers already constitutes a true decline in the spread of the disease. The statement continues to say that the decline in total number of cases and the decline of weekly laboratory test positivity rate coincides with several factors, including low laboratory tests, shortage of laboratory test kits, deviance from the national testing strategy, and minimal contact tracing over the past 3 weeks. So you can see they are already poking holes into the Kenyan strategy in as far as the minimal contact tracing and who we are testing. But if you look at other numbers in Africa, for instance, South Africa, which was among the first countries to report the first infections, you'll see that Dr. Were, they have done 3.6 million tests, and out of those they have reported 625,000 infections. That's that's nearly 50% of the total infections in Africa. I am not saying that Kenya would be such a situation, but are there any concrete differences that you would cite between the other African countries and Kenya that would now make our situation not believable?
Not really. If you see how the virus have actually behaved in the other African countries, South Africa is a very a good example when they actually thought they were flattening the curve, and then there was a resurgence of infections because by portraying, giving out the message to the public that we are now doing well, then the public becomes complacent, and we tend to ignore the precautionary measures that we need to take in terms of social distancing, in terms of wearing masks, and then those are resurgence of actually the infection. So the behavior we expect for the virus in Africa just to be the same. Of course, South Africa cannot really be compared with Kenya because of their infrastructure and the response and the state of the health facilities and the number of testings they have done compared to our country. I know we're in thousands, them they've done millions, and our population is almost comparable. So I think for us to get a true picture, then we need to actually get a comparable ratio of tests being done, and then maybe compare with that and the rate of positivity out of those tests before we say we are out of the red.
Okay, all right. Of course, I will continue to monitor that situation because I'm trying to look at the population in South Africa, which is at not very different from the Kenyan situation. It's actually at 59 million, and Kenya's is now estimated to be nearly 50 million, but all the same. So now Kenyans have been hearing this information, reading the trends. Of course, there's that suspicion in the public that maybe this is not indicative of the truth, but what are they supposed to do? Because like you said, the virus is still in the community.
What we'll encourage the public to continue doing is to follow the public health measures that we have been doing, and I think we have it has helped us actually not to have at least numbers that are manageable by the doctors in this country. And so is to urge them to continue wearing the masks, to continue social distancing, to avoid the large crowds, so that we can continue monitoring these numbers, of course, correlating it together with the increased targeted testings of the most vulnerable population, so that we can have a clear indication of where we are. But if we just follow the trends from all over the world, the moment the public started relaxing and ignoring these guidelines, then there was resurgence. If you look at UK, you look at Spain, even if you look at South Africa itself, closer home, immediately they declared the lockdown was over. Then we quickly saw a resurgence of new infections because of people going back to their normal activities in total disregard of the public health preventive measures that we need to do.
Right, and of course, with WHO pointing out that our testing strategy has not been consistent and that we're not doing the contact tracing, at what point did we change all this? What's informing this drift in the strategy?
Of course, worldwide, you've seen there's been a shortage of kits, and most countries have been actually manufacturing from their own populations. And Kenya, we know we have been importing most of these kits. We haven't fully developed our local capacity to increase the testing and as the part of the community strategy, the community tracing of these infections. So we really need to develop our local capacity so that we can be able to get reliable data from the scientists that we can be able to use to actually monitor this infection in our midst.
Right, of course, there has still been this conversation about your colleagues in the profession, of them saying that several things are not being done right. We had a strike recently in Nairobi County. Would you have any information on whether this has been resolved in the counties, because we still hear of gaps?
KMA voiced its concerns in terms of the industrial disruption at this time, especially when we are dealing with a pandemic. Of course, we urge dialogue between the county NMS and the Nairobi strike doctors, who are able to actually amicably resolve this situation. And I know they are back to work and they are slowly implementing the things that they agreed upon. So with the situation on the ground, we still don't have full access to adequate PPEs, and this is the time that we need to be taking even more caution, where people have become more relaxed and think that we are done with the bad parts of this infection, of this pandemic. So I think still encourage the government and the administrations to ensure that we have quality PPEs, healthcare workers are protected, so that they can be available actually to take care of the citizens. Of course, Mwananchi has to continue following the Ministry of Health guidelines in terms of the public health measures that need to be taken.
All right, Dr. Andrew Were, President of the Kenya Medical Association, thank you so much for joining us this morning to have this conversation about what is being termed as flattening the curve. But like you said, we have to be cautious, because it does not mean that the situation is being depicted by the numbers that we're reporting on a daily basis. Thank you for that. We take a short break here on Daybreak. When we return, we'll be speaking to Joy Mdivo, who is a former magistrate and an advocate of the High Court. We'll also be speaking to Gladys Wanga, who is a member of parliament from Homa Bay County, but also the chairperson of the Finance Committee at the National Assembly. We'll also be speaking to Opio Wandai, who is the chairperson of the Public Accounts Committee of the National Assembly. And the conversation is around the cost of corruption. Of course, the past 1 week, we've seen several cases being taken to court, most of them being released on bail, running into millions. The latest one being of Okoth Obado, the governor of Migori County, who was released yesterday at a cash bail of 8.75 million shillings. But in totality, his family was slapped with a cash bail of 18.25 million shillings. And we understand they have already paid that and now they are free. So we have that conversation after the break. Stay tuned.